Good day, everyone. I am Rina B. Ruben, and our topic it is all about learners with intellectual disabilities. So, before we proceed in our topic, let's know what is the learning outcome. So, first, describe the learners with intellectual disabilities. Second, discuss appropriate educational approaches to address the special needs of the learners. So first, we have adaptive. Adaptive refers to the range of cognitive, social, and functional abilities individuals acquire and use in daily life. So when we say adaptive is, this is nag-describe sa mga practical skills and abilities sa person nga ilang na-learn o ilang na-utilize to navigate their daily life. Like, it encompasses practical skills. And practical skills like self-care or atong kanang ginabuhat nato sa atong balay, mga household tasks, then na-subject conceptual skills. When we say conceptual skills is like mag-manage ka sa mga kwarta, managing money and time tilling, and nasabtay social skills. When we say social skills is kanang to interact with others. So, someone would have a strong adaptive behavior can effectively manage their personal needs and responsibilities. So, adaptive behavior no is ato siyang is a practical skills and abilities sa usa ka tao nga ilang na learned or ilang na utilize through sa ilahang pag-navigate in their daily life. Next, we have functional curriculum. A curriculum focusing on acquiring abilities applicable to everyday tasks across various domains, domestic, community, recreation, vocational, and core areas. So, when we say functional curriculum, kini is educational approach that kanang directly nag-address sa needs sa individual by pamaagi sa pagtudlo sa mga practical skills nga relevant to their daily lives. So, instead of focusing solely abstract concept, kini is nag-emphasize siya sa application of knowledge and skills in the real world situation. So, kining approach is often ginagamit ni siya sa mga special education or sa mga vocational training. So next, we have independent life skills. Refers the fundamental skills required to survive in today's society. So when we say independent life skills, these are the essential skills required for self-sufficiency and participation in society. So we have here the example. Like example, when we are using an our phone. So, dali ta makig-socialize sa mga tao independently pamagi sa atong cellphone. And like if mag-shopping ta, dali ra ta maka-shopping through our phone independently. Like if always pug kaga-watch og mga cooking show, may nga na imong skills sa pag-cooking is murag makuha nimo siya sa paagi sa pagtan-arang og cooking show, and you know how to cook independently. So, how these skills are fundamental to daily life and independent living. So, by mastering these skills no is ma-empower imong self to live independently in your daily life. So, next is self-regulation. Refers to the set of capabilities and skills that enable an individuals to adapt their emotion, actions, and thoughts to meet different needs. So, when we say self-regulation, kani nga concept is essential ni siya for understanding giunsa as individual pag-cope ang ilang mga challenges o pag-achieve sa ilahang mga goals. So, self-regulation encompasses the abilities to, first, manage emotion. So, ato yung i-control ato ang mga emotion do para mas matama nato pag-express ang ato ang mga feelings. So, next is control action. So, it is important yun nga atong i-control ang atong mga actions sa atong daily lives para maka-avoid yun ta og mga impulsive behavior. So, next is organized thought. So, important po ni siya para i-organize ang atong mga thought, like atong mag-focus sa atong mga attention, mag-focus ta sa atong mga plan, and problem solve effectively. So, Self-regulation no, is crucial for success in all aspects of life. And ang individuals would know with intellectual disabilities is nag-require sila og mga specific support para mas ma-develop nila nga mga skills. And the ability for self-regulate is critical po siya for adapting to the different situation and meeting the personal needs. So next is the American Association of Intellectual and Development Disabilities, AAIDD, highlights intellectual disabilities is defined by significant limitation in both intellectual functioning and adaptive behavior. So, ang AAIDD no is nag-highlight siya og two crucial components. So, first is intellectual functioning. So, this refers to general mental capabilities including learning, reasoning, and problem solving. So, when we say intellectual functioning, nag-refers ni siya sa mga various cognitive abilities and skills that include reasoning, problem solving, and understanding complex ideas, learning quickly, and adapting a new situation. It is often measured through intelligent tests that assist abilities such as first, memory, second, reasoning, problem solving, and comprehension and attention. So when we say memory is, kani siya is the capacity to store and to retrieve information. And reasoning is the ability to think logically. And problem solving is the capability to find solution to the difficult or complex situation. And comprehension is understanding abstract concepts, language, and relationship. Then attention is the ability to focus and concentrate on task at hand. So we have here an example of memory. So if mag-study ka is dali ra nimo ma-restore and ma-retrieve ang information nga imong gistudihan. So kining adaptive behavior no is ato na ning na tackle gaina, which is ato sang A balik. So adaptive behavior is refers on how well a person can function in their daily life. It encompasses practical skills, like sa practical skills is atong self-care and atong ginabuhat nato everyday sa ato ang balay sa mga household tasks, and sa conceptual skills is kitong pag-manage sa kwarta and time tilling, and social skills is kitong pag-interact with the other people. And difficulties and adaptive behavior significantly impact a person's ability to live independently and participate fully in society. So, in AAIDD definition is na siya age of onset before 22. The limitation in intellectual functioning and adaptive behavior must have originated before the individual turned 22 years old. So, kanino is crucial ni sa criterion because it differentiates intellectual disability from other conditions nga makakause siya og cognitive decline or impairment later in life, like traumatic brain injury or dementia. So, kani nga developmental period before age 22 is critical for establishing the foundation of for adaptive skills. So next is AAIDD also emphasized the importance of considering other factors during the assessment of intellectual disability. So first is valid assessment consider cultural and linguistic diversity as well as differences in communication, sensory motor, and behavioral factors. Next is within the individual, limitation is often coexist with strengths. Third is the purpose of describing limitation is to develop appropriate needed supports. Last, with appropriate personalized support over a sustained period, the life functioning of the person with intellectual disability generally will improve. So next is type of causes. The AAIDD does not advocate for the classification of intellectual disabilities, but for the sake of eligibility, Must school often use the American Psychological Association classification. So here we have the level and the IQ score. So first in level is mild. We have a 50 to 70 IQ score, and moderate is 35 to 50. Severe is 20 to 35. Then profound is below 20. That's all. Thank you. Once again, I am Rina B. Rubio.
Good day, everyone. Today we will discuss the causes of intellectual disabilities, focusing on both biological and environmental factors. According to Richards and colleges, intellectual disabilities can arise from two main categories, which is biological and environmental causes. So, biological factors are related to genetic factors. These occur when the genes of the parents of the individual with the intellectual disability affect their genetic or chromosomal makeup. An example of this is Fragile X syndrome, FXS, which is linked to mutation in the fMRI gene found on the X chromosome. FX is more common in males and is responsible for a range of disorders related to intellectual disabilities. Another chromosomal abnormality is Prader-Willi syndrome (PWS). This condition is rare and can cause a range of symptoms such as low muscle tone in infancy, stone growth, and a strong urge to eat constantly, which often leads to obesity. Children with PWS may also engage in harmful food-related behaviors such as eating rotting food or stealing food. Another rare condition is Williams syndrome, which is affect about 1 in 25,000 births. It is characterized by unique facial features, heart and kidney problems, stone growth, and sensitivity to sound. People with Williams syndrome may also experience psychiatric conditions such as anxiety and hyperactivity, and show very outgoing and friendly behavior. Next is environmental causes. Moving on the environmental factors, these play a significant role in the development of intellectual disabilities. For instance, the mother's behavior during pregnancy can influence the child's brain development. Exposure to environmental hazards like lead can harm the child's brain, affecting their learning abilities and overall intellectual capacity. One of the most well-known environmental causes is fetal alcohol syndrome, known as FAS. This occurs when a mother drinks alcohol during pregnancy, which can lead to physical and brain abnormalities in the child. These children may experience growth delays, facial abnormalities, and neurobehavioral issues.
Hello everyone, so I am Althea Kim Diche. So the first part I will be discussing is the characteristic of a learner with intellectual disability that can generally affect a learner's cognition, adaptive behavior, speech and language, and their socialization. The following are characteristics of an individual with intellectual disability according to Shri and Shukla 2016. So first is the general cognition. General cognition, to its definition itself, refers to the ability to process information, retain, and solve problems. But individuals with intellectual disabilities may have cognitive impairments such as difficulty with abstract thinking and problem solving, limited ability to understand complex concepts, and need for additional time to complete tasks. So, in general cognition, with a learner that nasa intellectual disability, sometimes experience the struggle to understand some complex instructions. Next is learning and memory. So from definition itself, it involves the ability to retain information. But with learners with intellectual disability, it may experience memory difficulties such as difficulty learning new skills or concepts, limited ability to retain information, and it need for repetition. Ibig sabihin, kinalan pa balik-baliko ng isa ka instruction. It's because they have a kanaganing slow sila maka-retain ng isa ka information. So, it need to repeat ang task multiple times, and it's also need for a consistent practice. Next is attention. So attention is to maintain concentration. But learners with intellectual disability may have attention deficits. For example, the difficulty sustaining focus during task, easily distracted by the surroundings, and need for frequent breaks and reminders. It may struggle the learner to focus or to concentrate with the task that is given to them, and also dali sila ma-distract within their surroundings. So next is adaptive skills. When we say adaptive skills, it's all about the social skills. It encompasses skills necessary for daily living. So the learners with intellectual disability may require support with their adaptive skills. For example, assistance with daily living tasks, diba? Like dressing, sa pagligo nila, kailangan pa nilang assistance with that. And also support with time management and organization, guidance and social skills. It's because sometimes they struggle to initiate or to start a conversation, or they have a kanang low sila magsabot through non-verbal cues. So they need assistance with daily living tasks, and they also need some reminders. Next is self-regulation. It involves the ability to control emotion. But learners with intellectual disability may struggle with self-regulation. For example, mood swings, dali mag-change ang ilang mood, impulsive behavior, sometimes they interrupt in some conversation, makatras silang sapaw sa isa ka conversation, increase heart rate, sweating, pag makulbaan sila, maningot sila, and also it is response to stress, and they struggle to manage their emotions. Next is speech and language. Speech and language is the ability to communicate effectively, but learners with intellectual disability may have speech and language difficulties, such as difficulty articulating words or sounds, and also they have a limited vocabulary. Next is motivation. When we say motivation, diba, they are in terms of being motivated, inspired. So persons with learners with intellectual disability may face unique motivational challenges. They difficulty setting and achieving goals. It's because siguro of dili sila self-confidence. Yes, limited of self-confidence or self-esteem, and also they need for positive reinforcement. So kinahanglan jud ninyo sila istoryahon og tarong in terms of reinforcement. Dili ninyo dapat sila ikuan, like you have to communicate with them properly. Next is academic achievement. When we say academic achievement, is the ability to succeed in academic pursuits. Persons or learners with intellectual disability may face academic challenges. For example, difficulty understanding concepts, complex concepts or abstracts, and also limited ability to read or write, and they need for accommodations. So sometimes they need assistance in terms of reading and writing. So sometimes it affects their academic achievement. Next is physical appearance. So it involves an individual's physical characteristics such as mobility and also the sensory abilities. So learners with intellectual disability may have physical challenges that affect their daily lives. For example, hearing or vision loss. Okay, it really affects, diba, in terms of their daily living. After discussing the characteristics of a learners with intellectual disability, let's discuss this intelligence testing. So, intelligence testing, it is test, diba? Na-discuss naman siya in previous topic. So, what is the purpose of intelligence testing for individuals with intellectual disabilities? First is identification and diagnosis. So, intelligence test can help identify cognitive strengths and weaknesses, which can inform diagnosis of intellectual disabilities. Next is placement and accommodation. Test results can inform decisions about educational placement, accommodations, and support services. Next is progress monitoring. Intelligence tests can be used to monitor cognitive progress and adjust intervention or accommodations as needed. So that is the purpose of intelligence testing. So there are two specific intelligence testing. First is Stanford Binet Intelligence Scale 5th Edition or SP5. This test assesses cognitive abilities in children and adults, including verbal and nonverbal skills. It highlights to test verbal and nonverbal skills. Next is Wechsler Intelligence Scale for Children or WISC-5. This test assesses cognitive abilities in children, including verbal comprehension, visual spatial skills, and working memory. So these two intelligence testing can help to identify some targeted intervention in terms of giving assistance to the learner or to a person. Pag dawat na nila tong results from this two intelligence testing, they will come up some interventions, some accommodations in terms of giving assistance to these students. So it's very important, diba? With that, it is very important to identify their scores with the use of this intelligence testing. Thank you everyone for listening. I hope that you learned something from our discussion today. God bless everyone and thank you.
Good morning everyone, I am Princess C. Oranza, and today we are going to talk about adaptive behavior skills and how we assess and support individuals with intellectual disabilities. We will also discuss how education is adapted to meet their needs. What is adaptive behavior? Adaptive behavior includes conceptual, social, and practical skills needed for daily life. Adaptive behavior refers to the skills we need to live independently and interact with others. It includes three main areas: conceptual, social, and practical skills. Conceptual skills, language literacy, numeracy, and time management. This includes using language, reading, writing, and math. For example, knowing how to read a bus schedule or count change when buying something. Second one is social skills. Social skills, interpersonal skills, teamwork, rule following, and social problem solving. This helps us get along with others, follow rules, and solve problems. For instance, learning to share toys in school or understanding how to behave in public places. And the last one is practical skills. Self-care job skills, money management, safety, and independent living. These are everyday tasks like dressing, cooking, using money, and traveling with safety. For example, learning how to brush your teeth or cook a simple meal. Diagnostic adaptive behavior skills. Evaluates adaptive behavior limitations in individuals aged 4 to 21 years. Helps in diagnosing intellectual disabilities. Determines the threshold for significant limitations in adaptive behavior. The diagnostic adaptive behavior skills is a tool that helps doctors and teachers check if a person has serious difficulties with adaptive behavior. It is used for children and young adults aged 4 to 21 years. For example, if a child struggles to dress themselves, talk with others, or follow daily routines, the diagnostic adaptive behavior skills can help determine if they need special support. Vineland adaptive behavior skills measures adaptive behavior for individuals from birth to 90 years, used for diagnosis, special education placement, treatment planning, and progress monitoring. Includes parent, caregiver, teachers, and survey interview forms. Vineland adaptive behavior skills, another assessment tool is Vineland 2. This is test for a wider age range from birth to 90 years old and help teachers, parents, and doctors understand a person's strengths and weaknesses. For example, a teachers might use Vineland 2 to see if a student needs help with communication or social skills. This helps in planning the right kind of support for them. Academic skills assessment. Standards test for identifying intellectual disabilities through academic skills. Academic skills assessment. Some students with intellectual disabilities struggles with learning subjects like reading and math. To understand their abilities, experts use different tests. They use 3 different tests. The first one is Kaufman test of educational achievements. Assesses reading, math, and language skills. This Kaufman test of educational measures skills in reading, math, and language. Example, a teacher might use this test to check if a student can recognize letters and numbers correctly. The second one is Wechsler Individual Achievement Test. Evaluates problem solving and academic achievement. And the last one is Woodcock-Johnson. Number 4, Test of Achievement. Checks academic and problem-solving skills. Example, a student who has trouble writing complete sentences might take this test to see where they need extra help. And the last one is Woodcock. Measures cognitive, academic, and verbal skills. Test academic performance and verbal skills. Example, a child with difficulty understanding science and social studies concepts might take this test. Educational approaches for students with intellectual disabilities. Education for learners with intellectual disabilities has evolved to be more inclusive, focuses on effective instructions, specialized curricula, and differentiated instruction. Over the years, education has improved for students with intellectual disabilities. Schools now focus on making learning more inclusive by using different teaching strategies. Teachers ask the 3 important questions. The first one is, what should the students learn? Second, what skills will they need for daily life? And the last one is, how should we teach them? This helps teachers create a learning plan that meets the students' need. So there are 2 types of learning approaches for students with intellectual disabilities. The first one is academic curriculum. Based on the general education curriculum, reading, writing, math, and science needs modifications and differentiate instructions for students with disabilities. This is the same curriculum used in regular classrooms, including subjects like reading, writing, and math. Example, a student with an intellectual disability might learn math at a slower pace with extra support from a special education teacher. The second one is functional curriculum, focuses on real-life skills, example, using transportation, shopping, and food safety. Enhances independence, self-management, and social participation. Focuses on real-life skills that students will use every day. Example, instead of just learning numbers, students might practice counting money to buy groceries. They may also learn how to use public transportation, cooking meals, or others' food in a restaurant. In conclusion, assessments help diagnose and support individuals with intellectual disabilities. Educational approaches must balance academic learning with functional life skills. Inclusive education and specialized instruction improves learning outcomes. By understanding adaptive behavior and using the right educational approaches, we can help individuals with intellectual disabilities succeed in life. That's all. Thank you.
Good day everyone, my name is Princess Anne Acote Dondias and my topic is all about systematic instruction. So what is systematic instruction? It is a planned sequence that a teacher uses for teaching step by step for us to be able to learn well. It uses prompts that become scaffold to perform a specific task and also to develop self-independence. So when the time comes, there is no need to use prompt when being asked. So next is feedbacking. In this plan, a teacher provides reinforcement to the learners based on its response. For example, praising a child every time he or she participate or rewarding them for continuous manifest and desirable behavior. Next is independent life skills. So that requires to survive, also known as life skills or daily life skills. It is to survive in today's society, such as using telephone, engaging in social activities, and more. By teaching this, a learner become more successful when when done in the real life where these skills are being applied. Next is self-determination and self-advocacy skills. So this is to participate in independent. This is beneficial because as they contribute to their ability to improve their academic rewards, and it is important also to because as the vision for them in special education, it is for them to be able to think and to do on their own. So last will be the community-based instruction. So it is a method of teaching in which it is real life based, setting life workplaces, shopping, and more. This is effective, very effective in helping individuals require new skills. So it entails removing learners from confines of the school. That would be all. Thank you and God bless us all.